Hello viewers, welcome to this episode of Healthy India. Today we'll be talking about one of the commonest lung disorders everywhere in the world and also in India that we call as bronchial asthma. Some people call it asthma. हिंदी में इसको दमा भी बोलते हैं, ये सांस फूलना. All this is part of bronchial asthma and the disorder occurs in children as well as in adults. What is bronchial asthma? We all know it means breathlessness. Basically, bronchial asthma results when there is an abnormality in the bronchial tree. The bronchial tree is the airways tree that carries oxygen from our nose and mouth to our lungs. And what are the abnormalities in that bronchial tree that lead to bronchial asthma? The first is constriction of the bronchial muscle, the muscle that forms the bronchi that constricts. So number one is that, bronchoconstriction we call it. The second is that the lining of the bronchial tree that gets inflamed or swollen. And third is that the secretions in the bronchial tree, which are normally there, they become excessive. So there is constriction of the muscle, swelling of the lining, and increase in secretions, all of which combine to produce an obstruction to our breathing, resulting in an attack of bronchial asthma. To discuss the details about bronchial asthma, we have very eminent experts with us today in the studio. We have Dr. Viveknagia, who is the Principal Director and Chief of Pulmonology at Max Healthcare, Saket. And we have Dr. Vijayhadda, who is the Additional Professor in the Department of Pulmonary Medicine at the prestigious All India Institute of Medical Sciences, New Delhi. Let's start with you, Dr. Nangia. I very briefly described what is asthma, but what are actually the symptoms of asthma? How does one know that one could be having bronchial asthma?
Thank you, Dr. Mithal, for asking me that question. As you rightly said, there is narrowing of the airways. Airways are like tubes through which there is a constriction and the airflow becomes a little difficult to enter into the lungs. So, as the name suggests itself, patients usually come to us with breathlessness because there is not enough air passing through those air tubes. So, people find it difficult to breathe and breathlessness is a predominant complaint. Some of them could also be having dry cough, or if there is some phlegm, it would be very small in quantity and sticky in nature. 70 to 80% of these patients usually have associated symptoms of rhinitis also, or upper respiratory tract involvement, like running nose, stuffed nose, itching in the eyes, watering from the eyes, or any other symptom of allergy like skin allergy also could be manifested in these patients.
So tell me, can some people present just with dry cough rather than an actual acute breathlessness attack, Dr. Nangia?
So there is this whole entity which is called a cough variant asthma, in which people just present with cough, but do not, when they are clinically being examined, there is not that typical wheezing that we get to see in our patients of asthma. But when you get their further testing done, like pulmonary function test or nitric oxide test, they would usually reveal some evidence of underlying asthma also. One very important feature of asthma is the variability in their symptoms. There could be symptoms which are present in the morning but milder in the evening. They're present in the beginning of the week or not there towards the weekend, or they're only present during the change of season. So variability is a very, very important factor that you need to see when you're taking history of any patient with asthma.
So as Dr. Nangia told us, wheezing, वो सीटी जैसी आवाज़ जो आती है सांस निकलते वक्त, सांस जब हम लेते हैं, जब सांस बाहर निकालते हैं खास तौर से, that is called wheezing. And wheeze is a commonly used word amongst doctors. It really means that सीटी वाली आवाज़, that whistling sound that comes जब हम सांस निकालते हैं, when we throw out our breath. I come to you, Dr. Hadda. We'll talk a little bit about types of asthma. We understood the basic process and also the common symptoms. So is asthma is it a permanent thing? Is it an intermittent thing? What are there various types of asthma?
Thank you, Dr. Ambrish. I think this is very important because many people know that asthma is a disease, but sometimes the the presentation can vary. Just Dr. Nangia was telling that the symptoms can vary. In the morning, the symptom may be more, in the evening it may be less. Sometime even with season, change of season can change the symptoms. So broadly we can divide asthma in two types. One is intermittent one, where the patient will have symptoms for a short period of time, let us say for few months, and then rest of the year he will be okay, or maybe few months he will be absolutely no symptoms, and then again as soon as that season will change or some trigger will be there, patient will again develop all the symptoms of asthma. The second type of asthma is a continuous type of asthma or perennial kind of asthma, where most of the time of the year patient will have symptoms, and there will be no period when patient will be having free of symptoms, although the symptoms can lessen in intensity, but the symptoms will never disappear completely. This is one simplest kind of a classification, but for physicians there are other classifications also. Sometimes we say just simple asthma, where we treat with simple drug and all symptoms are controlled. Then there are difficult to treat asthma, where we require lots of skills, and where we also check whether patient is taking medication or not, is he taking properly or not, or diagnosis is right or not, and so many things. And then there is another way of classifying this is allergic asthma versus non-allergic asthma. I think that is very, very important for a general public.
Yes.
Because many times what happens is patient goes to the doctor, he will see the patient, and physician know that is say asthma, but he will not use that term asthma. He will say you are having some allergy. I will say that please do not use that word allergy. It's always say that you are having asthma, because saying asthma give a completely different connotation to the patient, and the patient will understand that he is having a disease. If you say just allergy, then he will ignore. So that is another way of classification, allergic versus non-allergic. When a patient is having allergic asthma, he will also have other features suggestive of allergy, sometimes say recurrent sneezing, rhinorrhea, the skin rashes. They will say that I will be developing multiple times that skin rash, urticaria we see multiple times. So if the patient is having these kind of feature, then we classify them allergic. If these are absent, then probably patient may have non-allergic kind of asthma.
So very important information. We are talking of asthma that can be persistent. Classically, we think of asthma as something just intermittent. And while the severity may vary, you can have asthma that persists even throughout the year. And similarly, there can be non-allergic types of asthma also, although typically it is more allergic. Dr. Nangia, what about exercise-induced asthma?
So exercise-induced asthma is a separate entity altogether, which you basically see in people who are involved in physical activity, especially outdoors. Usually the symptoms start after about 15 minutes to half an hour of starting the exercise, and sometimes as a late phase reaction can even occur up till 4 to 12 hours after the exercise is over. This basically happens because when somebody is exercising, they're breathing cold air inside into the lungs. So usually when we breathe air, it goes from the nose, gets humidified and goes into the lungs from the back of the throat. But in exercise-induced asthma, what is happening is that people are breathing with their mouth open because they're exercising. There's this rush of air going inside, and there's all cold, dry air where the upper airways are not getting enough time to cause humidification and moistening of the air. As a result, this triggers off a bronchoconstriction kind of a response in our airways. So this is what is called exercise-induced asthma.
So it's important to distinguish exercise-induced asthma from shortness of breath on exertion, which can often be a symptom of heart disease or some other condition. You need to be careful about that. Exercise-induced asthma is a specific condition. As explained, cold air, vigorous exercise, that is different from just, if you feel shortness of breath when you start exercising, that is not typical exercise-induced asthma, and you need to talk to your doctor as to what could be the reason for that. Also, there are discussions about occupational asthma. People who don't have asthma, but get it only because of their profession. You want to explain to us, Dr. Hadda?
Yes, it is very important entity because I have seen many patients who are coming to me, they are having asthma, and when they go to the workplace, when we take the detailed history, then we will come to know that whenever they go to the workplace, the asthma symptom get worsened. So what I mean to say is there are two types of occupational asthma. One is that asthma which was not there when patient joined that occupation. Let us say somebody is doing a work in a dye factory, and after, let us say, 1 year or 2 years down the line, he develops asthma. That is directly occupation related asthma. The other way may be the patient is already having asthma, but when he goes to the workplace, due to some exposure at the workplace, the asthma symptom get worsened, or maybe the previously the symptoms were very much controlled with the medications, but as soon as he or she goes to the workplace, their symptoms control goes down. So we can classify like that, the work initiated asthma versus work aggravated asthma.
So two
these
types
are,
of occupational asthma.
These are two type of asthma. I think both have little bit of different approach. So if somebody is having, let us say, work related worsening of asthma, then probably counseling, change of workplace or like that we need to advise. But if it is work initiated, then probably we need to be little bit more strict in asking that you need to change the occupation altogether. So that is very important thing to classify it.
So again, very relevant information coming out here. One of the questions that is often asked is about childhood versus adult asthma. And you know, I know of children who were told that, or parents who were told that this child has got asthma, but he'll outgrow it. And childhood asthma is not anything to worry about so much versus adult asthma. Dr. Nangia, you want to explain that?
So basically, when we see children coming to us with asthma, what is very important is to see if there is a strong family history of allergy in these children or not. If not, then probably it is just related to wheezing that they're encountering because of a viral infection, change of season, air pollution, and so many other factors. So that may just be a temporary wheezing that they encounter, and then they may outgrow it as they grow. As the immune system develops over a period of time, when they reach their teens, they usually outgo all these things. But that does not mean that it cannot recur in their adulthood. That only means that they have, for the time being, they have been able to outgrow, their immune system has been able to fight the various allergens that they've been encountering. But they need to be careful in future. Then there is an adult onset asthma, which we see when people develop only in adulthood. In adult onset asthma, there is less of allergic component involved, more of environmental factors that are involved.
Thank you, Dr. Nangia. And with this, we'll take a short break and we'll soon be back with more information about bronchial asthma. Welcome back after the break, and now I go to Dr. Hadda. And you know, we've been talking about that usually asthma attacks are either sudden out of the blue or aggravation suddenly, you know, either onset sudden or aggravation of pre-existing breathlessness. So obviously there are triggers, and that's one of the things that one has to try and avoid, the triggers. So what are usual triggers for asthma?
So in my practice, people are coming to me, and when we dig up the history, most of the time either it is a smoke, dust, then it's a common practice, especially the housewives, when they cook food and then they fry food. So as soon as that they put oil and then they put masala in that, then suddenly that fumes are coming. They are very common kind of a trigger. Then change of weather, then probably change of season also, because as the season change, the pollen change,
Yes.
and especially the allergic kind of asthma, they change with the weather. And then many times they use perfume that can be very or any kind of strong odor that can aggravate asthma. So I think these are few commonly described triggers in my practice and in books also. There are so many, but whenever we ask the patient that what is trigger, it's very difficult to find out what exactly trigger is. But we should discuss this with the patient that usually for asthma exacerbation there will be triggers, and they should be little bit more cautious that during last period of exacerbation what all he or she was exposed to. If they come to know, then we can probably avoid that, and patient can be follow that precaution and can avoid the exacerbations.
Yeah, I mean, I think it's very important information, because if you are able to identify the trigger, then you have really a good chance of battling asthma or avoiding attacks. Even household mites and others, when people do home cleaning during Diwali or other times, there is a huge aggravation of
I think
asthma
that is important contributor to the aggravation during Diwali.
Yes.
One is of course the worsening of pollution.
Yes.
But I am pretty sure, because in our tradition during Diwali
We
we
always
do
clean
lots
out our
of
homes,
cleaning, and there will be lots of dust, and we are all exposed to that.
Yes.
And that may be very, very important trigger, which can be, I think, avoided if we take a little bit precaution.
Can stress be a trigger? Patients sometimes say, patients say that they get their attack when they get very stressed.
This is well described, psychological stress, if something goes wrong, emotional liabilities. These are very, very common kind of trigger, and it's not uncommon.
Okay. Dr. Nangia, about other triggers, like, do you see smoking? Obviously, I think it's an obvious question, obvious answer to smoking as a trigger is important, but do you have to be a smoker yourself to trigger asthma, or can you just, trigger off your own asthma even though you didn't smoke?
So smoking is a very important risk factor in the development of any lung condition really, whether it is inflammation in the lungs, cancer in the lungs, or even infection in the lungs, because it grossly reduces the immune system that our lungs offer to the various bacteria and the viruses that we inhale through the air that we are breathing in and out all the time. So, and this smoking does not necessarily have to be to the smoker himself. That is called an active smoking, and then even passive smoking can be equally harmful. In fact, what we don't realize is that the smoker himself is only inhaling 1/3 of the smoke inside into his lungs. 2/3 of it is actually coming out in the environment, which the innocent bystander is actually breathing in and harming themselves. So even passive smokers are equally at risk of developing asthma, of developing various infections. We have to remember that cigarette smoke carries almost 5,000 plus toxic substances which can damage our lungs, out of which nearly 50 of them can cause lung cancer. So smoking is something that if somebody is indulging into, needs to quit if they want their asthma to come under control and protect themselves from the various other respiratory illnesses also.
So the importance of passive smoking, which is if your partner is a smoker, or even if you enter a room where people have been smoking and are not smoking right now, there are enough toxins lingering in the air, in the curtains, on the tapestry to actually trigger attacks in some people. So I think a very important message about smoking again. What about infection, Dr. Nangia?
So viral infections are a very common trigger for bronchial asthma. As I said in the beginning also, anybody who's developing a mild cold, cough, we need to remember it's one common lining from the tip of our nose right into the depths of the lungs. So any infection or inflammation that is there in the nose, throat is bound to travel down into the lungs one day or the other. Therefore, it's very important to nip it in the bud. Don't consider it like a common cold, zukam, as people say it, कि तो हमें होता ही रहता है, हर change of season पे होता रहता है. What we don't realize is that this recurrent cold and cough ultimately results in a lingering inflammation inside our airways, which one day gets converted into bronchial asthma.
So the role of infections again, and especially infections that happen more during winter and the attacks of bronchial asthma that happen during winter, the role of infection is important. Therefore, protecting yourself from infection by using the right kind of measures, including vaccination for appropriate respiratory conditions, is very important, because that also can aggravate not just infection but also aggravate bronchial asthma itself. Dr. Hadda, about precautions. We've heard so much about what can do. What should I do? We know that so many things can trigger my asthma. But what should I be doing? What overall precautions should somebody who has asthma, should that person be observing?
I think the most important thing is the compliance with the therapy. So any asthma patient, they should always remain in contact with their physician, and they should never ever stop treatment without advice of the physician. So in practice, even in literature, it is well described. The non-compliance to the treatment is the commonest trigger. So that is one thing which all patients should keep in mind. Second thing is, you should, as we are saying repeatedly, you should not smoke. Even you should avoid the second-hand smoking, especially if your spouse is smoking or your parents are smoking. You can stay a little bit away, or their parents or spouse can put an effort to stop smoking. Then I think there are few vaccinations can also be given to prevent the, especially influenza. So influenza vaccine can be very useful. And then if somebody have identified the trigger, they can put their effort to avoid triggers. There are few triggers which can be easily avoided. For example, deodorants, which are very common triggers. These can be easily avoided. Similarly, the scent battis, which we usually use for during puja, that can be easily avoided. So there are few things which can be easily avoided. But again, I am saying the most important thing is compliance with the treatment. That is the most important thing.
So does masking play any role? Sometimes if you're going to be exposed to dust for sure, or you're cleaning your house as an example, does wearing a mask reduce the chance of allergic reaction or asthma?
Theoretically speaking, yes, it should. And if the same question would have been asked 2 years back, I would have said no, there is no role of mask. But during last 2 years or so, we have experienced that during this COVID period, because mask was almost universal phenomena. So we have seen that somehow bronchial asthma control was little bit better. So it signifies that there is some role of mask. So definitely there will be some cut down of maybe pollutant in the air, or the dust particle which are going inside our nose or airways, or maybe pollutants which are, or pollens which are used to go inside, we are stopping that. So it seems that mask may be useful. But if you ask me the data, I don't have any data to say that.
But I guess where you know that the trigger is coming from the environment, you know that there is dust that triggers it, perhaps it's logical to try
I think
it out.
one important thing which I can highlight here is, from environment we can stop with mask probably. For example, if there are pollens, somebody is allergic to pollen, we can stop. But many times the patient is allergic to the house dust and house dust mite, which are lying in their bed, pillows. So most of the time they will develop symptoms as soon as they go to the bed, where there will no role of mask.
Understand. Great. So, Dr. Nangia, when should an asthma patient make an SOS call to his doctor? Listen, I need to see the doctor urgently. What are the signs that as a patient, हमारे दर्शक यही पूछ रहे हैं कि अगर मुझे है asthma है और अटैक शुरू हो, कब ऐसा ज़रूरी है कि मैं तुरंत डॉक्टर के पास जाऊं?
सबसे पहले तो ये बहुत ज़रूरी है हमें समझना कि एज़मा एक क्रॉनिक बीमारी है, जैसे कि हाइपरटेंशन है, डायबिटीज़ है. एज़मा के लिए भी लॉन्ग टर्म ट्रीटमेंट लेना बहुत ज़रूरी है. सो इट इज़ नो लॉन्गर एन एपिसोडिक इलनेस एज वी कंसिडर्ड इट, कि जितने दिन आपको सिम्टम्स थे उतने दिन हमने इन्हेलर्स लिए और मेडिसिन ली और उसके बाद बंद कर दी, फिर वी वेट फॉर द सेकेंड अटैक टू हैपन. वेल, वी हैव टू प्रिवेंट दैट सेकेंड अटैक विद ऑल द प्रिवेंटिव स्टेप्स दैट हैव बीन जस्ट मेंशन्ड बाय डॉक्टर हड्डा. But despite your regular medication, if you're experiencing symptoms like breathlessness, if you're feeling cough, persistent cough which is not settling down, you're sweating, you're finding it difficult to breathe in, respiratory rate is going up beyond 20, there's tightness in the chest, constricting feeling in the chest. Nowadays you also have these simple device called pulse oximeter which is easily available, and you check your oxygen level. Your oxygen level is dropping below 94%, and asthma below 94% would be considered serious illness, and the pulse rate is going up. All these things would basically suggest that there is a kind of an emergency that's going to emerge. You're sitting on a volcano which is ready to erupt. Before it erupts, go to the emergency and do not waste more time.
Great. So, important information about what are the bad signs, what are important signs for us which should lead us to a doctor sooner rather than later. How do we monitor asthma, Dr. Hadda? I mean, okay, like I'm an endocrinologist. We tell our patients, monitor your blood glucose, monitor your blood pressure, get your tests done, the blood test done, get your eye check, whatever. How do we monitor asthma other than symptoms?
I think most important will be a symptom obviously, but there are some objective parameters also.
Yes.
We can use some specific devices which measure peak expiratory flow. So we say that peak expiratory flow meters, which are very simple to use device, where patient is asked to blow in a kind of pipe kind of device, and that can measure that how much is the peak expiratory flow is there.
And these are all available for use at home, right? People just
yes,
use peak
they
flow
are not
meters.
very costly also.
Yeah,
It is easily available, and we can ask the patient to monitor their peak expiratory flow rates if required. But usually I think these are mostly used in pediatric age group. In adults we usually don't use unless it is under some kind of a research project kind of thing. Otherwise we usually don't measure so closely. Most of the time we focus on symptoms. The patient should not have any kind of symptom during sleep, maybe cough, maybe dyspnea, there should be no symptoms. And similarly during day-to-day activity there should be no symptoms. If these are not there, then we will say there is a complete control of asthma. But if there are few symptoms, then we will say mild control or like that. So we can classify on that.
So one of the things that patients sometimes tend to do is they modify their lifestyle to adjust to those mild symptoms. And then they feel they don't have any symptoms. This is a normal human sort of thing. So what Dr. Hadda is telling us is very important, that you have to carry on with your normal activities. Don't restrict your activities. And then you should be symptom free. That is good control of asthma. And if advised by a doctor, don't hesitate to use the flow meter to judge exactly how your lungs are working. We are nearing the end of the program, and I request Dr. Nangia to very briefly outline for us the treatment strategies that are adopted these days to treat asthma.
So, treatment strategy basically relies mainly on inhalers. We need to understand that inhalers are absolutely safe. There's a lot of stigma associated with inhalers. There are a lot of myths associated with inhalers, but I must say categorically here that inhalers are just another way of delivering the medication. Like you have tablets, syrups, injections, so are the inhalers. The advantage of inhalers in fact are several. First of all, we are giving them in microgram dosages as compared to a tablet which would be in milligram and syrup which would be probably also in milligrams. We give only in micrograms, which is 1/1,000,000th the dose. Second, the side effects are much lesser. Why? Because these are going directly into the lungs and not getting absorbed into the bloodstream to a very large extent. On the contrary, when we give somebody tablets and syrups, they go into the stomach first, then they are absorbed, going into the GI system, through the liver, through the blood, then reach the lungs. By then have caused so many side effects. So side effects are much, much lesser with the inhalers. And also that they're acting directly at the target site where they're supposed to act, that is in the lungs directly. So it has to be an inhaler based therapy that we have to give to our patients. Now therapy is divided into two parts, controller part and reliever part. As I said, we consider asthma also like a chronic disease now, like diabetes, hypertension. So all these patients need to be on a regular controller therapy or a maintenance therapy where they continue the inhalers on a long-term basis, because the inflammation inside our airways takes time to go. It doesn't go so easily. So if you stop this controller therapy, the symptoms will keep coming back and forth. So you need to continue with your controller therapy on a regular basis. On top of that, if somebody is having symptoms, then we advise them to use a reliever therapy. Reliever therapy comprises basically of bronchodilators, along with some inhaled corticosteroids could also be used for the same purpose. So controller therapy and reliever therapy are two mainstay therapies that the patient needs to be understanding and using. So to our patients, we usually advise them to carry a peak flow meter also with them, which is another very simple device, inexpensive to use also, where they can keep monitoring their peak expiratory flow rates. And if the peak expiratory flow rates fall below a certain level, then they take an extra dose of their inhaler. This is called the asthma action plan that we discuss with most of our patients with asthma.
Fantastic information, but this program would be incomplete without a comment by Dr. Hadda on the role of breathing exercises, the role of pranayam. How do these things help us protect ourselves from asthma?
So first of all, I will say that all exercise have multitudinal kind of a effect. So everybody should exercise without missing. The second comes to what is the benefit for asthma. So the respected international societies all recommend that all patients who are having respiratory disease, be it asthma, be it COPD or any, all patients should be advised to follow pulmonary rehabilitation program, where we advise them to do some respiratory exercises which strengthen their diaphragm. These exercises will also help them to help in coughing, how to cough out the phlegm, and how to take a efficient kind of breathing, how to use pursed lip breathing when they are in distress, like that. So exercise I think is a very important aspect of all the respiratory disease, including bronchial asthma. So in our institute, we usually advise to all the patients to enroll in pulmonary rehabilitation, and our physiotherapist is there. Depending on their need, they will prescribe them specific therapies, whether they are having difficulty in bringing out sputum, or they are more dyspneic at rest, or they are having more cough, or like that. So depending on their symptoms, we advise them exercise. But in general, even if you are not consulting any kind of a physiotherapist, you should continue exercise in any form, be it yoga, be it swimming, or be it gymming, or whatever you are comfortable with. You should always keep on doing exercise.
So deep breathing and pranayam, they have clear benefits in people with asthma?
Unfortunately, I don't have much knowledge regarding that, but yes, I have heard many people that pranayam, yoga, these have many positive effects on asthma, and I did a small study also to see the effect of yoga in asthma, and we found that there are some positive benefits, especially in the form of reduction in inflammatory markers. And that study was published in Chest. So yes, there are some objective parameters, but the study's sample size were very small, approximately 50 patients or so.
So there is a huge role of non-pharmacologic, non-drug therapies also in bronchial asthma, like in almost all the chronic conditions we've discussed on this program. And in this case, it's about exercise and breathing that can help your lungs become stronger, build their immunity to fight off infections, restrict the chances or lower the chances of developing acute asthmatic attacks. With these words, we come to an end of this show. Thank you, Dr. Nangia. Thank you, Dr. Hadda, very much for being with us and giving our viewers so much valuable information.